Good morning, everybody. I am Dr. Anurag, Awasthi, one of the orthopedic surgeons practicing in Gurgaon, India. Today we talk about a very common problem which we see in our day-to-day practice, that is of shoulder pain and stiffness. Now, patients with shoulder pain and stiffness come with a variety of backgrounds and history. A lot of youngsters come following a incident of pain or while playing racket sports like badminton, like lawn tennis, or after a throwing action in cricket. A lot of people between 25 to 35 years of age come to us with a history that they were lifting a very heavy weight in the gym and they felt a sharp tinge of pain. All these history or episodes are followed by some discomfort around the shoulder which sort of stayed beyond the normal 3 weeks, 4 weeks of time. A lot of people in the more of a middle age come with the pain starting without an obvious injury. They feel that when they got up in the morning they felt a pain around the shoulder which sort of refused to settle down with time. A lot of patients who are more than 40 have been found to be diabetic. Some of them have high uric acid. All these things can lead to different problems happening around the shoulder joint. So today we discuss 3 common problems or 3 common diagnoses which we make. The first one is called as a rotator cuff tendinitis, which means just some inflammation of the muscles of rotator cuff which attach around the shoulder joint. Commonest among them being the supraspinatus muscle. The second subset of patients have a rotator cuff tear where some fibers or maybe complete fibers of this tendon called supraspinatus gets detached from its point of attachment. The third subset of patients come with pain and stiffness which has been going on for a few weeks to few months. A lot of them are diagnosed as frozen shoulder. So when a patient comes with a shoulder pain, it is very important to understand the history of evolution of symptoms. If there is an injury preceding the pain, then we suspect more towards rotator cuff tendinitis or a partial tear. Both these things will be painful, but the movements will be fairly moderately retained. If, however, there is a patient who has been having a shoulder pain for a while, maybe a few weeks or months, they go into a phase where the shoulder joint starts getting stiff. So they find it very difficult to move the shoulder in different axes. Such patients who have started with a rotator cuff tendinitis or maybe a partial tear have eventually progressed to what we call as frozen shoulder or technically adhesive capsulitis. Why it is important to differentiate the individual terms is the treatment is specific to the condition. A lot of such patients can respond to standard non-steroidal anti-inflammatory medications, some cold packs, restriction of activity, maybe some physiotherapy at times. A lot of our patients who come to us have already tried these measures before they reach out to us. So at times we ask patients to undergo MRI if we are suspecting a rotator cuff tear or a significant tendinitis. A simultaneously check for uric acid is very important, or if the patient is diabetic, a control of blood sugar is very important if we want long-term resolution of symptoms. Now, most of these patients, whether it is rotator cuff tendinitis, whether it is partial rotator cuff tear, or adhesive capsulitis, they can be managed conservatively with a combination of medication, restriction or modification of activity, and physiotherapy. A small subset, maybe 5 to 10% patients who are resistant to this treatment or who have a diagnosed rotator cuff tear, which is a full thickness tear, or who have sort of a slap lesion, they may need to go for what we call as an arthroscopic shoulder surgery. So if you have been suffering with a shoulder pain and it sort of refuses to improve over a 3 weeks, 4 weeks span, please don't waste time. Please reach out to an orthopedic. Let it be examined properly, let them ask for or do the required investigations, because if there is an early diagnosis, we can give you the appropriate treatment. So stay connected and please reach out to us for anything related to the shoulder pain.